Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and here's new news in the vitamin department, our old favorite. So, the headlines in New York Times this week were low vitamin D levels linked to disease in 2 big studies. Yeah. People with, and it's written by Nahad O'Connor. Published April 1st, so it's all new news. People with low vitamin D levels are more likely to die from cancer and heart disease and to suffer other illnesses, scientists reported in 2 large studies. And the research suggested that blood levels of vitamin D are a good barometer of overall health. Now, the study doesn't answer the question of whether low levels of vitamin D are the cause of the disease or simply an indicator of behaviors that contribute to poor health, like a sedentary lifestyle, smoking, a diet heavy in processed and unhealthy food. Now, vitamin D, the author goes on to say, is nicknamed the sunshine nutrient. It's produced in the body when the skin is exposed to sunlight. And vitamin D can be obtained from foods, including fish, eggs, dairy products, some meats, vegetables like mushrooms. And blood levels of vitamin D can be lowered by smoking, obesity, and inflammation. Now, vitamin D helps the body absorb calcium, which is an important part of the immune system. So I'm sure you're all thinking about going out and getting your vitamin D and calcium, right? Well, the problem is that people that took supplemental vitamin D, had no benefit. Wow, isn't it interesting? So if you have low vitamin D, it's not good for you, and you take supplement vitamin D, it doesn't work. But in people who took another form of vitamin D, which is found in fish and dairy products produced in response to sunlight, they had an 11% reduction in mortality from all causes compared to adults who didn't. So, interestingly, don't rush out to get your vitamin D and calcium. It doesn't work. The 2 studies were meta-analysis that included data from more than 1 million people. They included observational findings on the relationship between disease and blood levels of vitamin D. And they looked at randomized controlled studies, which we call the gold standard, that assessed whether taking vitamin D daily was beneficial. Dr. Franco and his co-authors, a team at Harvard, Oxford, and other places, found persuasive evidence that vitamin D protects against major diseases. Adults with lower levels of the vitamin had a 35% increased risk of death from heart disease, 14% greater likelihood of death from cancer, and greater mortality overall. But again, when the researchers looked at supplements, there was no benefit. Only those who got vitamin D through fish and dairy products in response to sunlight had 11% reduction in mortality from all causes. So, wow, pretty interesting, right? Now, Dr. Franco and his colleagues calculated that roughly 11 to 13% of all deaths in the United States and 9% in Europe could be attributed to low vitamin D. So I'm going to go out and get some fish. What do you say? There was a second study that was published in the British Medical Journal from a group at Stanford and studies in Europe that presented a more nuanced view of vitamin D, suggesting that evidence showing high vitamin D levels protect against diabetes, stroke, hypertension, and other diseases. But they said there was no highly convincing evidence that vitamin D pills affected any of the outcomes. And they said, quote, based on what we found, we cannot recommend widespread supplementation. So, interesting that vitamin D is important, but you can't take it through a pill to get better. You have to exercise. You have to eat better. You have to get your fish, get your vegetables. Vitamin D, and the study went on to say, vitamin D pills should not be recommended until clinical studies underway shed more light on the benefit and potential side effects. And we know from other studies that some people who are taking megavitamins and other vitamins actually have an increased death rate. So again, I'm warning and stating these studies showed that it was vitamin D from food, not from supplements, that made a difference. If people who took supplements, vitamin D, didn't help. And these were large studies conducted in a orderly fashion by serious doctors in the field. So it's a pretty important update. Might save you some money and might provide you with years of life. Let's get a healthy lifestyle, avoid the supplements, and do the right thing. I wanted to give you a little update on our 100-year-old woman. I know a lot of people have been following her. This woman came into us about a month ago. She had profuse bleeding. She lost half of her blood. She was ready to die from bleeding from a bladder cancer at age 100. She was diagnosed when she was 95. She thought, what the heck, I'm 95, how can it bother me? Well, yeah, a few years later, at age 100, this past month, she came in nearly dying of a bladder cancer that was bleeding out. She could have lost all her blood. The cancer grows, eats through the blood vessels, and she was dying. Her daughter brought her. It was a very loving daughter and very concerned daughter. The mother didn't want surgery, didn't want chemo. She wanted pinpoint, focused, stereotactic body radiosurgery, non-invasive treatment. We offered it to her, and we promised to see people within one business day so you don't have to wait and suffer. We treated her. By the second of the 5 treatments, the bleeding was gone. She said all the 5 treatments, the bleeding has not come back. Most probably the cancer is shriveled up or dying or dead. Certainly not bleeding. Her blood counts are going up, and she's doing well. It gives you a lot of ideas about the work that we do and the proof of the work that we do. And I can tell you, as a physician, see a patient like this is reassuring and makes us grateful in the technology, and we see the results every day. Wouldn't be here if we didn't have good results. Wouldn't recommend this treatment. Wouldn't recommend it for myself, my friends, or loved ones if I didn't believe in it and see it. We treated about 20,000 patients. This woman is one of those 20,000, and fantastic results. And speaking about another fantastic results department, good news department, we had a man flew in from Italy this week. Now, this man came to us 10 years ago, more than 10 years ago, with prostate cancer. We treated him with our premium program, which is a short course of external treatment in the stereotactic frame and brachytherapy. And he's been in remission ever since, cancer-free, doing well, fully functional. He's about 70 with a 32-year-old girlfriend, so he's probably doing very well, seems to be. And 18 months ago was diagnosed with a pancreas cancer. Now, in Italy, they told him he had to have surgery and a Whipple procedure. He came to us for a second opinion. We staged him up, which was not done in Italy. They were going to do the surgery on the pancreas Whipple procedure, which is a big operation, without staging him, without knowing where the cancer was. We staged him, and we actually found that he had a metastasis to a lymph node. Had he gone through that surgery, which is very morbid and sometimes fatal, there would have been cancer left behind in that lymph node. It was away from the pancreas. So we were able to treat in 5 fractions the pancreas and the lymph node. And he's been in remission for 18 months. And he got a new PET scan this past month, and he was told in Italy it was A-OK. He sent it to us. We had it reviewed. We found a new single site of metastasis. He wanted to come immediately to see us, and of course we try to accommodate everybody. I saw him on Wednesday. I said, maybe you want to get a new PET scan just to make sure they did the PET scan right since they misread it. And we can see if there's been any change in those 3 weeks. He got a PET scan immediately, didn't have to wait, compared the two, and actually found that that new tumor in the mesentery, in the abdominal area, had grown just in 3 weeks. We talked about all the options, surgery, chemo, radiation, etc. And, of course, after the success he's had, because he was told a year and a half ago he was a goner, he chose to have radiosurgery. Came in on Wednesday. We treated him Thursday, Friday, so he's already had 2 of the 5 treatments. I'll have the next 3 next week. He's doing great. He's actually upstate on the holiday this weekend. No side effects, no nausea, no vomiting, no blood loss, no hair loss. Enjoying his life. Happy that he knows us. He brought me a book of his region with an inscription, which is a beautiful inscription. Most likely he's going to do well. We're going to finish the treatment this coming week. We're going to get a follow-up scan. He's going back to work and to his 32-year-old girlfriend, and we wish him well and good health and hope he lives to 100 anni, 100 years. He deserves that. And there's new guidelines that limit the amount of surgery necessary for women with breast cancer. Now, it doesn't have to be women. 1% of breast cancer are men, but most people are women that have breast cancer. And there's a new report out showing that the sentinel node biopsy should become more widespread. Now, the sentinel node is to biopsy the main lymph node and not do a complete axillary dissection. Axillary dissection means a surgeon opens up the woman's armpit and takes out a glob of fat and lymph nodes. And the problem is, number one, this is often very painful. Number two, it often leads to arm swelling called lymphedema. And number three, it's not superior to sentinel lymph node biopsy. With sentinel lymph node biopsy, usually just a few or a single lymph nodes removed and checked for sign of cancer. If these have no cancer, it means that the remaining unchecked lymph nodes are probably cancer-free and that the radiation will wipe up any cancer cells. Actually, data shows that, and we've reported it on the show in the past. This is a new study. So there's more women eligible for sentinel node biopsy. It should reduce the number of women who undergo more invasive procedure called axillary lymph node dissection, which has a higher rate of complications. Our goal of this program and our goal of life is really to decrease complications. In that axillary dissection, most lymph nodes under the arm are removed and examined, and it can cause long-term side effects like pain and numbness and swelling, lymphedema. So the new guidelines state that for women with sentinel node that shows no sign of cancer, that more axillary dissection is not recommended. So unfortunately, we see a lot of times people get axillary dissection nevertheless. So we're telling you, if you have breast cancer, give us a call or come in. It's always best to come in and talk about it. This study was published in the Journal of Clinical Oncology last week. It's very important for women and their surgeons to know that you do not need such extensive surgery on the armpit. If you have breast cancer, we can do with less. Radiation can make up the difference. And obviously, for most women with breast cancer, you don't need to remove the breast. And in fact, we have data that we presented last week showing that the results, the success rate, likelihood of being alive, was better with lumpectomy and radiation than mastectomy. So don't think you have to have mastectomy to have a better chance of success. It doesn't work that way for most women. And again, I cannot promise you for 100%, but for most women. We're going to hear from a new voice, and then we'll be back. If you have questions, call us at 800-321-0710. We're live, 800-321-0710.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique.